So welcome everybody to the Rupe Biennial Conference, and the theme is communicating about COVID-19. And I think that's a perfectly reasonable topic to be talking about now. There are a lot of conferences, a lot of research, a lot of policy work, a lot of media coverage, and then of course an awful lot of human suffering, animal suffering too, but not only the millions of deaths, but also only recently has the suffering of people who have it but then don't die. So they can end up being what are called long haul survivors. So there's an awful lot we don't know yet about the long-term effects, physical effects of having had COVID, even if you don't, die. And then of course, all the economic and social disruptions. So it's really radically changed our world. There are many, many different ways of thinking about this, but we're here taking a communication approach because I'm in the Department of Communication, as are many of our presenters. And COVID itself is communicative. That is right. It transmits by interacting. If you interact with other people, can be directly. It doesn't have to be direct. It can be indirectly through moisture in the air. But then also, as with most public health, we have to talk about it a lot to help understand it, to share it, to help people, and then also communicate what to do. And one of those things was wearing masks, and we're going to have some presentations on that as well. So I think it's a really rich topic. It's a very important topic. It's a very sad topic. It's unfortunate that we have to be talking about this, but that is nature. And over history, people have had to deal with pandemics throughout the world. So I'm going to give a brief thanks and introduction in a minute, but I just wanted to go over the program. We're going to start right here, and then each session is 75 minutes, and so we have a 15-minute break between each one. Then the second session is on interpersonal approaches. The third one is on message approaches. The fourth is on media, and the fifth is on organizations. And you can see there's kind of a progression here from the individual up to the organizational level. So there is actually some thought behind this. Let me stop this. I'm sorry, let me go to the next slide. So there's an awful lot of people to thank. This doesn't get done very easily or by myself. So I want to thank the Arthur and Rupe Foundation. I am the Arthur and Rupe Professor in the Social Effects of Mass Communication, and that is funded by a nice endowment from Arthur and Rupe, who is still alive here in Santa Barbara. Very smart, very nice guy. And he's represented today by Mark Conway, who's the president of the foundation. So I want to thank him and the foundation. Charlie Hale is the Dean of Division of Social Sciences. We talked about this. He had some great ideas. Rosia Torres, Office of Development, she also helped formulate some of the ideas. Friend Cheska Palomino is officially our department senior undergraduate advisor, but I've given her this new title. She's the Web Zoom Shoreline Wizard. I learned a lot from her, and she trained me on Shoreline. We have several social media interns who have prepared a lot of materials for us. We really appreciate their work. The Office of Public Affairs and Communications, which is run by no less than John Longbreak, who will be presenting soon. The UCSB Com Alumni Council, which has provided some comments, and also two of our presenters in the last session. Tanya Dunson, the Department Business Officer, who makes everything work in the department. So Charlie, our dean, has probably figured out that Tanya really is the department. The rest of us just do her bidding and try not to get in her way. Michelle Friedrich is our financial assistant, who makes money flow, usually out, not so much in. Nora Dunbar, who's our department chair, she was very supportive of this idea. She will present later. Gavin Kirkwood is our co-host, and he'll also be the Q&A moderator. He's a graduate student, and he's doing some really interesting research. We have a wide variety of presenters, and then the co-authors. So I'm going to introduce the presenters, not the co-authors, but keep in mind that on our website, there's a full program, there's full bios, there's pictures, there's abstracts, there's more information than you can possibly need. And I will track you down next week and quiz you on all of it. And you, of course, are a great audience. We now have 85 people, so it's fantastic. And then here's a brief overview of each session. We're going to start with a quick poll, which I'm going to do in a minute. We'll have some brief introductions. except for the first session, everybody will have 20 minutes. So there'll be 3 presentations, 20 minutes. Throughout this time, you can post questions to the question and answer. And throughout the process, Gavin will be monitoring this. And at the end of the presentations, in the last 10 minutes, he will ask a couple of questions to the presenters. And sometimes it could be to all the presenters, or sometimes it could be just one specific. So your questions will reappear at the end. Here's the site for all that information that I mentioned, and that's been in all the details that you've gotten. It's also on all the shoreline information. And then at the end, if you're a student, well, actually, if anybody, we're going to automatically, we'll send out a brief survey, like 3-4 questions at 6:15. So if you're not a student, please feel free to provide some comments. If you are and you want extra credit, you have to complete that. It's very simple. It just asks you which class and which sessions. That's all it does. All right. So at this point, we're here at the beginning, and I wanted to briefly introduce Charlie. I'm sorry. Yeah, Charlie's our dean. He's been extremely helpful and very supportive and provided a lot of good ideas. He is the Sage Sarah Miller McCune Dean of Social Sciences. He's also a professor in the Department of Anthropology and the Department of Global Studies. So he's a very, very busy guy. He's a leading social science scholar whose research bridges multiple disciplines with a focus on race and ethnicity, racism, social movements, and identity politics among Black and Indigenous peoples in Latin America and the Caribbean. So this is a man of no small set of talents. We're extremely pleased to have him as our dean, and extremely pleased to have him as our welcomer and introducer. And so I give you Charlie.
Thank you, Ron. Good morning, everyone. It's wonderful to hear that there's nearly 100 people tuning into this very important conference, and it's my sincere pleasure to welcome all of you. I want to give special thanks to Ron Rice for taking the lead in organizing this biannual conference, which has been become something of a tradition here at UC Santa Barbara. We look forward to it every other year. And as Ron noted, there's so many dimensions of this pandemic, the topic of the conference, that are communication related, I'd say even communication dependent. From basic information about the disease to dissemination of public health advisories, to radical changes in the prevailing modes of social interaction, to representations of the consequences. It's often hard to study an arduous process in which you're also immersed. And I have to say that COM scholars in this department have really shown us the way, producing an amazing array of research as the crisis has unfolded on these dimensions of the crisis. And this conference will pick up on a lot of that work. So when Ron suggested the topic 6 months ago, I responded immediately, this is a brilliant idea. A further dimension of this topic is the crucial acknowledgement that public health challenges like this one can never be addressed and understood if we remain in the realm of the biomedical. Vaccine hesitancy, risk tolerance, patterns of social interaction to either prevent or reinforce the spread of the disease, the list goes on. The biomedical actions are, of course, crucial. Our challenge is to forge substantive, meaningful integration of these actions with rigorous sociocultural, political, and economic analysis and action. Enter the social sciences. The third dimension is, of course, health disparities, the vast differences in every health index, from contagion to death rates to differential impacts of public health measures, according to a series of intersectional inequalities in societal hierarchies. These underlying conditions in the aggregate constitute a societal call to conscience and action. This conference responds quite literally to that call. The fourth and final dimension I want to emphasize is transformative opportunities brought on by a public health crisis like this one, opportunities to be seized and pushed forward. We in the social sciences have been saying for some time that we must adamantly reject the return to normal mentality. There is way too much in the status quo ante that is simply unacceptable. Underlying conditions that undermine effective responses and distributed the impacts in unacceptable ways. Transformative opportunities are lines of action that, rather than band-aids to patch up or paper over, strategically combine direct measures justified by the crisis with institutional change that moves our communities forward toward greater equity, justice, and inclusion. This last point is the ideal bridge to my introduction of our esteemed keynote speaker this morning. Dr. Van Reynoso is a product of the UC system, a BA at UC Santa Cruz, MPH UC Berkeley, and a PhD at UC Merced. Before coming to Santa Barbara to assume the directorship of the county health department, she worked in public health departments in Tulare County and Madera County. She came to our community just a few years ago, just before the pandemic began, and since that time has distinguished herself as a visionary, courageous, and tireless leader throughout these extraordinarily difficult 18 months. She's brought a sharply focused equity lens to the county health department, approach that embodies in deeply inspiring and proactive ways this principle of transformative opportunities. Allow me to offer a few examples. A radically inclusive and participatory approach to serving the essential workers of our county, primarily Latinx and Indigenous community members who put food on our table but have been excluded and locked out when it comes to meeting their basic health needs. The creation of a new position in her office devoted to health equity. Resounding support for a County Board of Supervisors resolution that identifies institutionalized racism as a public health crisis. And a lead role in forging a closer and more collaborative and reciprocal relationship between the County Health Department and UC Santa Barbara. And that's just a short list. We know it's not been easy for you, Vaughn. We know that some of these principled stances you have taken have brought you considerable heat. We applaud and admire you, Dr. Van Reynoso. It's my great honor also to introduce my colleague, John Longbreak, Associate Vice Chancellor for Public Affairs and Communications. John served as Assistant Vice President for Communications at Harvard before his first appointment at UC Santa Barbara. He left to become Vice President for Communications at the University of Chicago for 2 years and came back in 2017, where he assumed his current position. And in so doing, confirmed one of our Chancellor's favorite affirmations. Our truly valued colleagues at UC Santa Barbara rarely leave, but if they do, not to worry, they'll soon be back. John is currently responsible for coordinating communications and marketing efforts across the university and oversees government and community relations, as well as the Office of Event Management and Protocol, Alumni Relations, and the UC Santa Barbara Foundation. John is always on the front lines of our university, and yet another affirmation of how crucial communication is to all that we do. This importance grows to colossal proportions in times of crisis. In the case of the pandemic, these crisis conditions have been seemingly interminable. Throughout, John has projected calm, consistency, clarity, and conscience as he narrates our situation, explains our policies, and reiterates our principles, first speaking among ourselves and then to the broader university community. Throughout, he somehow remains cheerful, upbeat, and helpful with regular flashes of good humor. Thank you, John, for all that you do. I suspect that neither Vaughn nor John have gotten enough sleep over the past 18 months. This makes us especially grateful for your presence today for this opening session, The Role of Communications in policy setting during a crisis for consensus-driven decision-making organizations. Please join me in giving a warm UC Santa Barbara welcome to Dr. Van Doronoso and John Longbreak for our opening session.
Thank you, Dean Hill, for your kind words. And it is a pleasure to be with you in this space for the next couple of hours. So, Ron, shall I start?
Yes, please do.
Great. Share my screen with you. I'd like to talk for the next 20 minutes or so on the strategic public health communications that the County of Santa Barbara undertook throughout the pandemic. So I'd like to begin by setting the stage. On March 11th, the World Health Organization declared COVID-19 as a pandemic. But prior to that, the clamor for information began, with the first cases reported out of China on December 31st, followed by the cases that we saw in Europe. The United States had our first cases around reported cases on January 21st. California had our first reported case on January 26th. And then, of course, Santa Barbara County reported our first case on March 15th. We also followed many other countries by declaring the state of emergency. California, the governor declared the state of emergency on March 6th. Santa Barbara County followed quickly on March 12th, and then President Trump declared the state of emergency on March 13th. And so these are critical dates because they underscore the demand for information, the heightened sense of urgency, of anxiety throughout our community and throughout our state and our nation. So quickly, we decided that the information we could not, there just wasn't enough of both myself and our public health director, health officer, Dr. Henning Ansorg. With the first cases in California, we immediately received multiple requests for information, speaking engagements. The community was frankly worried. There wasn't a lot of information being given, and the information given were often conflicting. So Santa Barbara County Public Health Department was the tangible source of information that our community could reach out and touch. Bottom line, they couldn't reach the governor's office, they couldn't reach CDC or World Health Organization, but they can reach out to the public health department. So quickly, the team decided that what are the goals that we need to put in place? And the first was we needed to provide timely and responsive communication. And in doing so, we aspired to promote collaboration and partnership, quickly realizing that the public health department cannot do this by ourselves. We needed collaboration from outside entities in distributing and being our partner in the communication. And we needed to facilitate positive change. We needed to exhort people and inform people towards what is it that they need to do, what is it that we need to do as a community to mitigate the disease from early on via testing, via the transmission of disease, and now via vaccination. And the pandemic quickly illustrated the health disparities that are there, but perhaps had been so silent, that had been a non-priority to everyone other than public health and those in serving the community in healthcare services. We quickly realized the disparity. We saw it across the country. We saw it in major urban cities in California, and then we saw it in our county. So quickly, we decided that we had to be committed to ensuring equity in our communication as well as in our policy. And the bottom line is, in addressing health equity, what is the message that we need to give to our community to foster resiliency? And Dean Hill mentioned that the pandemic is an incredible once in a lifetime opportunity for transformation of our community. So we quickly seized on that early on. What is it that in our communication that we needed to do thoughtfully, intentionally, so that after the pandemic is over, quote unquote, what is it that we can do to ensure that people are aware that this is an opportunity for us to change the landscape through policy, through systems, and through the allocation of resources so that everyone in our community can have that optimal opportunity to achieve health. So these were early on in February and early part of March 2020, before we set out our strategies. So with the goals in mind, we developed a consensus around strategies to achieve our goals. And the first one was we needed trusted leaders to deliver messages. That meant that I needed to be accessible to our community, and especially communities that traditionally have not had opportunity to access leaders. So what I mean by that is me being accessible to any of our underserved communities, uh, being very mindful that they had equal access to me just as elected officials had access to me and my team. So we developed trusted leaders within the department and within the county and within the community on core messages that we are all going to deliver. Um, we also, another strategy that are any communications that we push out had to be specific and relevant to the audience. The message to the general broader community has to be different from the message to the underserved community, has to be different to the elected policy makers. Two things that I wanted to note is that from the get-go, our commitment was not to use Google Translate because we just found that that was not consistent in translating the messages. From the get-go, the commitment was anything that we push out had to be in Spanish at the same time, not as an afterthought, but in real time, concurrently. And then we also realize with regards to language justice, pushing out messages, communication in Spanish and English wasn't enough. We needed to engage the community in producing the messages that we needed the community to hear in Mixteco. So that meant partnering with a variety of community organizations so that we can create Mixteco videos in multiple variants so that everyone in our community could hear and have access to the same information. We also, another strategy is being adaptable, utilizing multiple platforms to reach all sectors of our community. That meant utilizing Facebook, Instagram, Twitter, using newspapers for people who are not on social media, using radio station for people that aren't into newspapers and social media. So, and so our game was that it isn't one size fits all, but that we needed to be adaptable and we needed to be specific about the platforms to convey our messaging. We also considered early on, what is the broadest mechanism for us to distribute information? And that was through press conferences and briefings online, via TV and in print, as one core way of distributing information so that everyone also gets the information through a reliable source, us. We also devoted much resources to creating a dashboard for our community to access to get information and not have to rely on any of the aforementioned platforms and sources. So in order to achieve the goals and the strategies that I've shared, we realized that we had to assemble the infrastructure as well as the external partnerships to be able to effectively communicate around COVID-19 issues. So internally, our communications team included bringing on board Supervisor Greg Hart early on. He was the third communication expert on our team. We needed as a in an elected position of power, we needed to engage a Supervisor Hart in the communication as part of what we were doing. And Dr. Ansorg, our health officer, myself, the other critical person behind the scene was our public information officer, Jackie Ruiz. She was the single point of contact. Quickly, we realized that having media, having requests come in to multiple people, there was a lot of confusion. So early on, we learned that appointing and designating Jackie as our public information officer really cut down and really streamlined the requests and the messaging that we needed to give. We also solicited participation from 20 internal staff who were trained as health educators. A lot of our messaging is utilizing public health trained messaging methods, communication methods, and paradigms to reach the populations that we needed to reach. And we also, after the message was created by our health education team, we distributed and we met with PIOs from other departments, other cities, and community agencies to say, this is a message that we created. How can we partner with you in order for you to be equal partners with reaching your sector, your clients, your patients, with the message that we need them to hear. And as if this was not enough, we quickly realized that we did not have the expertise and the capacity to do the fancy web design, the fancy slick messaging, the look and feel of a professional. We may have had the message, but it was not necessarily in the optimal packaging. So we hired professionals, media communicators, media specialists who package everything that you see that we've pushed out in the last 14 months. So with communication strategies focusing on policymakers, we did frequent briefings to elected officials. They needed real-time information because their constituents were asking them for information, and we needed to engage them to be our partners in distributing that real-time information. And a lot of the cities and even our board had to make policy decisions. For example, closure of beaches or testing or workplace safety, a lot of the policy decisions needed real-time information. So early on, sometimes for months, we met every other day, and we briefed the board, the elected officials, for an hour. We also did formal briefings to the board that the public has access to. But prior to that, we also had um, uh, meetings with the board to hear their concerns, to get at the questions that they were hearing and the concerns that they were hearing from their constituents. So the policy decisions flowed both ways. We needed to hear from our board and from our elected officials, what were the community concerned about? And so that informed us and guided us in our policy decisions. For instance, in designing the testing rollout, or designing the isolation and quarantine, or designing the mobile clinics for vaccination. We had legislative calls on a weekly basis with our local elected officials, and our state officials wanted to hear boots on the ground, what's happening in Santa Barbara, so that in Sacramento and in DC, we could get the resources that we needed. And to ground our cities and outside agencies, and to ensure that they're not left hanging out in the wind. We also had regular meetings with cities and agencies to ensure that they have the information that they needed to support us in the COVID-19 response, and to keep them safe as well. With the general public, we did 94 press conferences. So one of the goals that we had was, it was not enough for us to brief the board, but we also want to make sure that the general public had access to information as well. So 94 press conferences. We issued 259 press releases. And we designed a COVID-19 portal that has a record 10 million visits to our website. Our social media, so every time you see a Twitter, every time you see an Instagram or a Facebook post, know that it is a lot of work. I was surprised. It takes 2 full-time staff, 7 days a week, to be able to push out in real time information so that the public is engaged. And I'll give you an instance why that is important. We often in the testing had access that the public wasn't using. We often had access to vaccine appointments, even at the height of demand, that the public wasn't aware of. So we use social media to push out real-time availability, and they were quickly used by the public to acquire the resources. We also had targeted campaigns to the general public. We had, as you can see, the Help Us Help Them was a targeted campaign to make sure that the seniors in our community could be helped by everybody else around them who were a little bit more tech savvy in acquiring vaccine appointments. And so we did a lot of very, very focused communication to various communities as we saw the need, as the need presented itself. So to the underserved communities, we engaged trusted community leaders. We were so grateful that this pandemic allowed us the opportunity to strengthen our partnerships with many groups. And one of the shining moment in the pandemic is us being able to collaborate with Dr. Melissa Smith, as many of you are aware of her passion for health equity and for community participatory and community engagement. And so Melissa and I put our heads together in the early days of the pandemic and to address what is it that we need to do to communicate to our community about the health inequities and the health disparities that exist, based upon cases that we were getting about North County cases, primarily the Latino population, primarily living in North County, primarily working in the ag sector. How was their access to testing, to isolation and quarantine, to vaccination, and to supportive services? So Melissa and I stood up the Latinx and Indigenous Migrant COVID-19 response task force. And I really want to give a huge shout out for Melissa and the UCSB students who have been a major support to the public health department, and in pushing out and engaging the communities as our trusted partners to communicate the urgency of the information. So not only did we engage trusted community leaders through the task force, but we also engaged them and letting us know what's dire, what's burning down. And through this communication with the community, we were aware of the critical need to issue health officer orders to mitigate the spread of disease, particularly in H2A housing and in homeless shelters. So we were the first county in California to put that forth. We also acknowledge quickly that it's more than being culturally appropriate. It's more than making sure that our communications are in Spanish and Mixteco, but we really needed to make sure that everyone who is on the team is aware of the critical need for language justice, and that key priority is to ensure language justice in all of our communications. That was a strategy to earn trust and to be heard, and to acknowledge that this our communication, our partnership with the underserved communities is critical, is important to us. We also stood up town halls specifically to give our underserved communities an opportunity to ask questions, and to be heard as well. And we from all of the conversations, from all the key informants sessions, and from our partnerships, we stood up the HRSA equity pods, making sure that farm workers, making sure that residents in public housing, in low-income housing, seniors, unsheltered population, community members who had limited English skills, all had access to services, and all had access to vaccines. And that was, and we did this before the state mandate. And that is huge kudos to our county. So I wanted to end with some reflections about communications. Joint collaboration, as much as it was our goal, and as much as it was intentional on our part, joint collaboration is not always possible. And we found that out through a very painful way via when we had the prison outbreak early on in March 2020. That when entities on the federal level operate under a different premise, that not being transparent with information may not necessarily be their first priority. And it was painful because public health was all about, let's disclose everything. Let's tell the public how many cases there are in the prison. Let's tell the public, because the public had loved ones in the prison and they were worried. So we wanted to be a breaker, a bridge to that. But we found out that it was very difficult to do, and we did the best. So quickly, one of the things that we realized was a joint collaboration was not possible. We were daily reporting on cases, active cases in the prison, and cases that were hospitalized, and deaths. And those numbers are very important in capturing the landscape of the outbreak. And unfortunately, it was awkward. It got very, very, very awkward when our numbers did not match with what the prison officials were reporting, and being called out in the public, and having to honor our partnership with the prison officials, but also feeling compelled to share what we had. We also, another reflection, timely information is critical. Um, and that means being able to share data so that the community is aware of the landscape, and that we were confounded in in being able to provide timely information, because sometimes we did not have the data, and many times we did not have the state guidance to share. And the reflection there is acknowledging that we don't have the data, acknowledging that we don't have the state guidance, and that's okay, but that's what our community needed to hear. Another reflection is that accurate information engenders trust, and that was in it. Even though we're tired, even though we are dealing with an overwhelming set of data points, that we needed to make sure to check the information, not once, not twice, but perhaps 4, 5, and 6 times through different eyes. As you may have remembered, we had to disclose in August 2020 of a local data issue involving death records. And because of the gaps in our infrastructure, in our technology, in our workflows, we were not timely in disclosing the number of deaths due to COVID-19. And that I want to say that that was a dark moment in our communications, and having to share that information was a very painful very painful time in the COVID-19 communications. And then we thought we had it bad, and this is where it was just like, great. It's not honorable probably, but I when the state disclosed their huge million of cases lag, I was like, oh, okay, we're not the only ones. And so it just really disclosed that the pandemic disclosed that we have systems in place that can't that did not have the capacity to generate accurate information in a timely manner in a pandemic of this magnitude. And so we, since then, have really strive to push out accurate information and acknowledge when our information is incomplete, but this is the best that we have. I think the other reflection is the critical need for constant communication. When the public doesn't hear from the public health department, there's always worry. What are we not saying? And so we have to be mindful and intentional about distributing new information, distributing new data. However, we think it's not important, we need to disclose that. For instance, when the pause, we heard about the pause in the Johnson and Johnson vaccine hours, in the wee hours of the morning. I want to say before 6 a.m. And quickly, we were able to distribute that information that morning because the community had already heard and wanted to hear. And so we didn't wait for others to distribute that information. And the guidance, as soon as we hear about guidance from the state, we distribute that. And I think the critical need for constant information is absolutely necessary to dispel the misinformation. And it is very time consuming. It is very resource intensive, but it is critical for us to be on top of the misinformation so that we can dispel it before it takes roots and before it spreads like wildfire. Ask the truth. I'd like to end with two slides. The data. I like to say that we have to ground ourselves in data. Data is the foundation of what we need to do. So, want to share with you our early dashboard. This is a screenshot from a presentation that I did to our board. It was pretty basic. It was pretty rudimentary. It was the best that we could do in the middle of a pandemic. And we have evolved in our sophistication. And again, this is a product of a private public partnership between Legacy Works, between UCSB, between other community, between Cottage, between a lot of community stakeholders. This is our current dashboard. It has a variety of information from very technical to very broad for our community to gauge the course of disease in our community. And this is our public information portal. As you can see, it has access to vaccine information. It has access for the business sector about Orange Tier. It has our data. It has everything that anyone in our community might want, might need. And so we worked really, really hard on this in making it accessible. And I'm proud to say that, again, this is also a product of public and private partnership to ensure that our community has timely access to information to guide their personal decisions, to guide their business decision, and for us to mitigate the spread of COVID-19 and begin our road to recovery. And with that, I want to thank everyone for this time and for allowing me to share a little bit about our journey these past 14 months.
Thank you very much. That was, as a researcher, what you presented in this short period of time is really an entire book. I mean, it would be a fantastic story to share with other people, other researchers, other practitioners, all the things you had to go through. And I think also for our students who are interested in communication, marketing, PR, public health, you've shown that it is an extremely complicated, extremely difficult, extremely challenging, but also extremely significant role that you play and the public health plays. So I really appreciate that. I learned a lot too. And I immediately thought I would love to go and work with her for several months to write this up. And I think that's just not fair. She has way more important things to do. So thank you so much. We're going to come back at the end with some questions. We already know we have one or two. And thank you so much. We're now going to shift to John. John Longbreak is going to look at kind of similar issues, but from the University of Southern California, UC Santa Barbara perspective. Thank you so much.
My pleasure. Thank you, Professor Rice and Dean Hale, for inviting me to participate in this program. I am really quite honored to be joining the esteemed Dr. DeBrenoso, as well as all of the other panelists and everybody on this list. I want to talk a little bit about sort of communicating the communications in a consensus-driven organization such as a university. COVID-19 has made this really one of the most challenging years since I've been in the communications business. That includes sort of the financial crisis brought about by the Russian ruble devaluation in 1998, the financial crisis in 2008, where the university I was working at had to communicate about massive workforce reductions and financial losses in excess of $10 billion, and as well as some of the most challenging events right here at UC Santa Barbara, maybe most notably the events of 2014. In university communications, I feel like I've dealt with almost every kind of possible crisis imaginable. You have the natural disasters, hurricanes, blizzards, fires, oil spills, infectious diseases, including the H1N1 flu, meningitis, all kinds of crimes, protests, building takeovers, even responding to newspaper requests about one professor stealing manure from his neighbor's lawn. I won't mention the institution's name where that happened, but it was an Ivy League institution in Cambridge, Massachusetts. But every year brings sort of something new, and this last one was a doozy. A little bit about myself. I started out doing policy analysis for the US Congress, and what that entailed was identifying all the potential policy options that could address the problem that you were looking at, comparing those problems and choosing the most effective, efficient, and feasible one. I was working pretty exclusively in science policy, and I didn't even realize that communications was a profession or a career. And so at one point I was working on science-related policy involved with the Gulf War and Gulf War's illnesses. I'd finished my background research white paper, and it was clear that the issue that I was working on had moved from science and policy to about communicating that. The person who was doing the communications at the time, I noticed was in every important meeting, had their name in the newspaper, and the younger me saw that there was an aura of celebrity there. And so I jumped at the offer to move to communications and help out when the communications officer was overwhelmed, which is frequently the case. So after a decade in Washington, DC, working in government, several political campaigns, and doing some healthcare work, I moved to higher education, where I've been for the last 2 decades. At the time, many of my friends wrongly assumed that working at a university is a sinecure, that you would have the summers off. I knew a little bit better than that, as my father was a professor, and I had heard all of his stories about the politics of a university, but I really wasn't fully aware of what working at a university entailed. Now, my dad, he loved the university, and he was right. These places are amazing institutions that play an essential role in society, but everything my dad complained about was also right. Throughout my time at universities, and I've now been at 4, I've heard the university been derogatorily compared to being run like a corporation. My experience, things couldn't be further from the truth. In fact, in my tenure, I've seen multiple people come from corporate jobs in the corporate world into the universities, and they expect that they're going to make a command and 50 people are going to have to jump to follow through. These people usually go running from the university after less than a year, shaking their heads at the perceived inefficiencies. And yes, there are inefficiencies, but universities are really different organizations, different types of organizations with different missions. Some see the inefficiencies as a problem, but they also have positive outcomes. For instance, one of the things I've learned is it's really important to engage the students in helping to develop communications materials. It may take a little bit more time, but you're going to get a more effective communication strategy out of that. There are deep misunderstandings about universities, even by many of the people inside them, because everybody really works with only a very small part of the university in their world. These are really complicated institutions. They are deeply complex with an extremely decentralized organizational and power structures. They're really more like small cities, and their leaders are closer to mayors. these institutions are consensus-driven organizations where almost all policy decisions are developed using consultation and debate involving myriad stakeholders. And the most respected university leaders that I've worked with really understand that process and know the importance of building grassroots support through consultation. Members of the faculty are really more like constituents and stakeholders. They're not really employees. When I was at Harvard, I attended a lecture with the then president, and I remember him, he introduced the faculty member and then sat in the front row to listen to her remarks. And I don't remember what her remarks were about, but I do remember that she opened up talking about the benefits of being a professor, how she loved the independence and not having to report to anybody. And then turned to the president, looked him right in the eye and said, "Sorry, Larry, you're not my boss." So these universities are places of ideas, and they draw people who have lots of ideas and are usually delighted to share them. Faculty are obvious examples. And at UC Santa Barbara, the faculty and the faculty senate have been involved in almost every major policy decision that I've participated in. We call this shared governance. And all of the universities that I've been a part of sort of exist on a spectrum. And UC Santa Barbara takes this very seriously. And we really exist at the far side of one of the spectrums. So in normal times, policymaking in a consensus-driven organization like a university is extremely challenging. You need to have a really good idea, and you need to spend a lot of time to build consensus around it. You have to be flexible. Now, this process, I think, is very effective at weeding out or changing bad policy before it gets enacted. And it's good at evaluating competing approaches and understanding nuances, which we at universities love nuances, and taking all points of view into account. Consensus building, as I mentioned, takes a long time, especially when there are so many stakeholders who want input into the process. And universities really have no lack of stakeholders. So in the decision-making process, you obviously have the president or the chancellor. You have the executive vice chancellors. You have the academic deans, the academic senate, the senate chair. The student body has an important role to play in this. And we do hear often from students here at UC Santa Barbara how much more of an opportunity they have here than their peers do at most of our sister campuses. Our staff are consulted. We have 2 separate staff committees. Both students and staff sit on all of our committees, but that's not all. We take into consideration directives and guidance from the UC Office of the President, the regents. Our policies are either affected or determined by state legislators, as well as local officials, including the county, the IVCSD, the cities of Goleta and Santa Barbara. And of course, we always take into consideration feedback from alumni and parents, donors, as well as public opinion. All of these audiences either are or consider themselves stakeholders in our process. And so another metaphor I sometimes use when describing our process is that universities are a lot like the UN Security Council. No single group of stakeholders has the power to say yes, but every single one of them has the power to say no. So communications is really a vitally important component of the policymaking process. You can spend weeks, months, and years developing strong, effective policies, but if you can't communicate them well, then all of your work is for nothing. And even a small communications misstep can be disastrous. And I've been in several occasions where policies are developed without the communications people, and then they're handed to the team with the direction of, here, go share this. It's really never well received, and it can cause a lot of slowdown or backtracking once you handle it that way. If it's integrated into the policy development stage, it can save you a lot of time and a lot of aggravation. So crisis communications. During a crisis, ideally, you start with existing policies that you've already developed or have sort of refined through previous experiences or tabletop exercises. Your policy group meets, and it either reaffirms or refines the policy. And again, your communications person hopefully is involved in that policy group. then it's communicated to stakeholders, you get feedback from that, you refine it again, and then you implement it through your operations group. You get feedback on it, and then you review the policies, refine them again, and communicate them again. It's really an iterative process. A normal crisis really strains this policymaking process of consensus building. Typical consultation and gathering input from stakeholders really does take a lot of time. And in a crisis, as Dr. Del Reynoso mentioned earlier, people want answers and they want them immediately. So a quick aside on social media, which Dr. Del Reynoso also mentioned, it really adds pressure on a consensus-driven model. When there's a void in communications, then people will fill it, either with anger or frustration, or more dangerously, misinformation and conspiracy theories. Social media, I have found, really makes everyone an instant expert whose voice is almost equal to that of the authoritative voices, with only, and that happens with only a very small amount of critical information. And they're allowed to share that very broadly. Universities, usually, we're not great at how we use social media. We use them to broadcast and listen and persuade. We don't typically use it for dialogue. I haven't found it to be especially useful for dialogue, mostly because it becomes extremely time consuming, and public institutions and universities don't really have unlimited resources. We only have one person right now who is working on social media, and they work with students quite a bit to help supplement that, but it is a full-time job 24/7. And again, the dialogue isn't always helpful. One instance is we just recently announced that Oprah Winfrey is our commencement speaker, and somehow rumors started that she was being paid for speaking. And then there was one individual who was posting on every social media platform that they could find, and was told, nope, she's not being paid. We had a dialogue with that individual, and they kept posting it, and in fact escalated, putting out rumors about 6 figures. So it really is an area that many institutions, especially universities, struggle with. It's a frequent occurrence that the need to communicate can actually catalyze this really lengthy decision-making process. Now, some institutions choose to circumvent the consensus-driven process during a crisis in order to speed up communications, and that certainly has the benefit of faster decisions and more rapid communications, but it does have high risks. It leads stakeholders to feeling left out and unconnected. It leads to substantial second guessing and can lead to often policy reversal, which can be very damaging to the credibility of the leadership, and it undermines the institutional leadership. Now, sticking with your typical consensus building model while having, again, the benefit of getting to talk about the nuances and getting stakeholder input also ends up in slower communications, which again can risk undermining the confidence in leadership. It can also lead to a breakdown in the centralization of communications, which can result in conflicting messaging and confusing the audiences. And I would say that a centralized or highly coordinated communications operation during a crisis is critical. It's as critical as a centralized decision-making process in crisis management. It inspires confidence if all of your voices are speaking from the same talking points. And in a university where our strengths are diversity of voices and vigorous debate, this is difficult. I am reminded of one instance where I was involved in this. I was at the Treasury Department in 1998, and one of our lower level desk officers decided to write a letter to the New York Times sharing their thoughts about the economic conditions in Brazil, and they happened to sign the letter with their title. And it was buried in the New York Times. It was one paragraph in the letters to the editor, but it resulted in the Brazilian markets dropping 5% the next day, which was hundreds of millions of dollars in jobs. So it really is important to speak with one voice. I think you can look at the initial response to the pandemic by the government as another example where different voices created serious challenges, and I don't need to expand there. So to me, it's always a challenge to find the right balance between the competing needs of being fast and thorough and between making decisions and getting stakeholder buy-in. Every crisis has its own unique trajectory, and finding that balance is different for every institution and changes for every crisis. When there's not consensus among the group, and that is frequent, the role of communications can really help catalyze the process, because we all know debates on policy can go on. And I found that sort of creating those communications and pushing those to the forefront in the policy debate, actually putting themselves in front of the policy groups and the stakeholders, can focus that process and can help them also understand the need to communicate quickly during the crisis and to make sure that they know what their audiences are saying and what the audiences expect. So the way that communications are managed really affects stakeholder attitudes, perceptions, knowledge, and behavior towards the organization. A well thought out communication strategy implemented in real time can be a factor in bringing about stability, order, and balance, even in the face of chaos. And if done well, can really help move the institution to the post-crisis renewal phase. And this pandemic has obviously created a system that I had never expected. There are so many things about the COVID crisis that are unique. Obviously, the scale. I mean, this is a worldwide pandemic. The number of stakeholders involved in the policy making is really, to me, unprecedented. The duration has really complicated the whole response. And then the level of uncertainty. I mean, it makes decision making incredibly difficult, especially when there are conflicting guidances and interpretations. It is just it's a very major challenge for policymakers. And in this case, universities like UC Santa Barbara, especially, we worked from precedent. We had had experience with previous diseases, the meningitis outbreak. Many of our team members were still here and remembered exactly how to respond to that. We knew how to restrict campus operations because we had been through it with the Thomas Fire. These experiences were extremely beneficial to us, and they really helped our campus come to really quick decisions regarding operations in early March of 2020. We were one of the first campuses to announce that we were restricting campus access and were asking students to remain at home. However, this relatively quick decision was made still with a significant amount of consultation, primarily with the faculty senate, but also with student and staff input. So at that point, students and parents really wanted more definitive answers. Some were easy. Do I get a refund on housing? How are you going to handle finals? Again, we had been through that before, but others about how long will you be closed? How are you going to teach classes remotely? What are you going to do with research on campus, faculty offices? We didn't have those experiences. And so that's a lot of the areas where we struggled and where the consensus building really started to take on a life of its own. Now, for those of you who might choose communications roles, practitioner roles down the road, I would offer just a little bit of advice. During a crisis, there is little time for your strategic planning and your strategic work. The crisis and the daily operations overwhelm all of your long-term strategies and goals. So it's vitally important to wall off a part of your team, if you have a large enough team, so that they can continue to move forward with long-term strategic goals and not get caught up in the day-to-day. That way, when you move to that post-crisis renewal, you have the momentum and things are still moving forward. I should also add that you should be really prepared to have a thick skin for criticism. Every crisis management situation I've been involved in, there's going to be one refrain you hear when discussing lessons learned, and that it will be a strong critique of your communication strategy. It's always, we didn't communicate well, or our plan was inadequate, or if we only communicated better. And you very rarely hear anybody say, wow, we weren't prepared. But I guess I should be careful saying that, because the one constant in all of the crisis communications I've been involved with is me. So, but it's part of the job. I think the bottom line is that every audience and stakeholder is focused on how an institution is communicating, and that almost everybody will always think it could be done better in the end. So it's important to assess your strategy throughout the crisis and make adjustments. And then you also need to take a very hard critical look at process after it's through, because it's important to learn from your mistakes. So I will hopefully quickly wrap up. Ultimately, I will tell you the people working to renew your organization and move to that post-crisis phase are working tirelessly, including through every weekend and every holiday. Policymaking in a consensus-driven organization is challenging in the best of times, but it can have very positive effects on the community and can improve your outcomes. So it's important to find the balance between consultation, thoroughness, and action. Ultimately, we're still in the middle of the crisis, I think, from a communication standpoint, and there are still countless decisions to be made. I think that the bigger challenge, rather than, when you're taking something apart, that's easy, but putting everything back together, especially when you want to make changes to the original, is going to be our biggest challenge, and that still lies ahead. So we have a long way to go, and I thank everybody for giving me the opportunity to share a little bit about universities.
Fantastic. You can, there you go. Yeah, we don't have, unfortunately, we don't have one of the images where people can clap their hands, so you can't see all the clapping. But I have to say, you won't get the criticism for this presentation that your communication was not good or effective. That was, once again, a tremendous overview, and I hope that people understand the complexity and the density and the interdependence and the problems in just making it through, and then also to prevent and respond to all these serious issues. So I'm very pleased that you're running the show with all your great staff. We do have a little bit of time. We're going to extend it about 5 minutes for questions and answers. And so I'm going to turn it over to Gavin Kirkwood, graduate student, co-host, Q&A moderator, technical problem solver, and general good spirit. Take it away, Gavin.
Hey everybody, thanks so much for the opportunity to be here. It's great to hear from just all these esteemed speakers and all the ways that they're impacting our community during this crisis. The first question that we have from the audience comes from an attendee, Doug, and it's for Dr. De Reynoso. Doug is kind of curious about how your department was able to reach undocumented residents of the community. Doug points out things like anti-immigrant messaging coming from Washington, issues that are related to undocumented residents in the census count, and maybe some cynicism that might have been impacting the way that this group interacts with your department. So what types of challenges, how did you overcome them?
Sure. Because we're in public health, we were very well aware of the worries and the anxieties from our undocumented residents. So quickly, and that is the reason, one of the reasons why Dr. Smith and I stood up the Latinx and Indigenous Migrant COVID-19 Rapid Response Task Force. Well, that's a mouthful. And we, through the task force, I committed to being present, to doing briefings to all the community agencies that were present on that task force Friday morning briefings. And there were approximately 92 member organizations that heard the public health's intention and commitment to serving the undocumented community. I think that that also, delving deeper into that, of the 92 plus member organizations that showed up, public health intentionally reached out to a handful that we knew were serving undocumented residents and making sure that they knew that we were firmly committed to services without question. One of the things that came out of, for example, the task force was that, undocumented community members in ag were worried when they were feeling symptomatic where they would go to get tested and how the government was going to document their testing results and how would they pay for it. And so quickly we created a flyer internally. I took it back and said, can we do this? So we quickly the policy was that we will treat anybody walking through any of our health centers free of charge, no questions asked about residency. We would test if they are symptomatic, we would treat. If they're asymptomatic and they are not positive, that's okay. We'll shake hands, we'll give you the health education, and we'll give you whatever you need to be to feel safe. So I think that when we made that policy decision and communicate that to the community, as well as our partners to push it out, we did get traction on utilization. I think there was a moment, if I could share, that will really epitomizes relationship building and how critical it is in COVID response. So one day I got a text from one of the community organizations on the task force that I didn't really know well, but saw me every Friday giving this speech. So she texts me and she's like, "You don't know me, but I got your number through, I think, Melissa. And if I can talk to you about a case." I said, "Sure." And it was a case where this community partner walking across a street saw a couple in their 80s who were undocumented and homeless, recently homeless, because of COVID-19. And so she reached out and she's like, "Okay, so, talk to me about your commitment." And I said, "Sure enough." And so we were able to place the couple into our project room key, where they had a nice, comfortable, safe place to live while we looked for permanent housing. And so that is a testament of our commitment to really moving barriers and moving obstacles so that we can serve our undocumented community members at whatever space they need our services. And so, and I do think that I know that our openness and our commitment was heard and was felt because of the volume of referrals that we received from our partners. We have done testing, we've done isolation and quarantine, we've done wraparound services, and these are all primarily done through trusted partners. And we have been doing mobile clinics in partnership with our community organizations like CAUSE, like Líderes Campesinas, like MyCop. Those are organizations that typically serve undocumented community members. So we've been partnering with them, going to a space in their offices, in their neighborhoods at a convenient time. So I think that the community has seen that and that has engendered a lot of trust and confidence that we are protective and that we will deliver the needed services.
Awesome. Thank you so much for talking about that important work that you guys are going to. We just have a couple minutes left, so just a quick question for Mr. Longbreak. Merica, one of my colleagues in the communication department, is wondering how other crises such as police brutality, systemic racism, or some of the other things that we've faced this year have compounded the crisis of COVID-19 in terms of how you respond to it.
Oh, it's a great question. It's made it much more challenging. Again, every single one of those crises in a normal year would take up a considerable amount of time and effort, and overlaying the COVID crisis on top of that, it just made it that much more difficult. I will tell you, a lot of my colleagues got a lot less sleep. Fortunately, the policy decisions in some of the other areas, there is a lot of overlap, but there are different people who sort of handle different parts of each one of those. I would tell you, again, I've gone back and we do lessons learned after every one of those. And we take a hard look at everything we've done, and we try to do it better. And we have all recognized that sort of the effort that we're constantly putting in terms of COVID is affecting how we are responding to everything else. We are trying to make sure that our team members get the time off that they need, but that has been incredibly difficult. And the other thing I would say that we're pretty good at is, before this all happened, we always tried to spend time looking forward and assessing all potential risks and trying to be prepared for as many as we can. And so that helps, again, the tabletop exercises, it helps you move through that decision-making and communications process a lot faster. But when you have one after another compounding itself, it is exhausting. And it does affect how well you work as a communicator.
Yeah. Well, thank you so much for your response. I've learned so much from this session. So we're going ahead and close session 1 out. Ron, did you have anything that you wanted to add in terms of helping folks get prepared for next session?
Yeah, just again, just those 2 presentations would be more than enough for most people. We really appreciate not only the work you do, but also your presentation about the work that you do.